We have to address urgently the twin scourges of our health system: poor continuity of care and fragmented care. Both made worse by the Health and Social Care Act, both made worse by multiple providers, by competition and a market-driven health service. And both made worse by perpetuating the divisions between hospital specialists and GPs, between commissioners and providers. But we have it within our power to change things. I'm not talking about major structural reorganisation, definitely not. Let's put an end to restructuring. We've had far too many restructures in the last 2 decades. Don Berwick summed it up perfectly when he wrote, "In good faith and with sound logic, the leaders of the NHS and government have sorted and resorted local, regional and national structures into a continual parade of new aggregates and agencies. Each change made sense, but the parade doesn't make sense. It drains energy and confidence from the workforce and from middle managers, who learn not to take risks, but rather to hold their breaths and wait for the next change. It is, I think, time to stop. The changes I envisage are not structural. First and foremost, we GPs are stewards of the NHS. But if we're going to secure its future, we have to evolve with it. We must restore continuity of care, the tool of our trade. We have to go forward together, and it will involve grasping some nettles. We have to examine historic systems, like the independent contractor model, and ask ourselves, is this 1940s model, created as a pragmatic solution at the time, still fit for the 21st century? We might also need to look at how we work together as small businesses and ask the same question. I believe GP practices working in isolation have served their purpose well, but their time has passed. Instead, we need all providers of health and social care within a geographically aligned area coming together and pooling resources. The RCGP federations could then evolve into integrated care cooperatives, provider organisations led by GPs. The aims of an integrated care cooperative would be to reduce fragmentation of care, improve continuity, deliver care as close to home as possible, and deliver best value for money. Primary, community, social, and acute care budgets merged into one budget. In other words, integration. Ironically, if the coalition hadn't imposed its unwanted and unnecessary top-down reorganisation, this move towards integration would probably have happened anyway.